Hi everybody, I'm Dr. Alejandro Castro and welcome to another video. Today we are going to review case-based question and learn a little bit about an important condition in cats that you will often encounter in practice. This discussion is crucial if you are preparing for veterinary board exams like the NAVLE. Okay, so let's start. Here's the case. We have a 9-year-old spayed female, domestic short-haired, with a history of halitosis, anorexia, purulent discharge from the mouth. On physical examination, a lesion is found on the buccal surface of the left maxillary premolars. So what would you tell this patient owner about managing this condition? So take a few moments to think about the answer before we go over the options. What would you do? What would you recommend? Pause the video if you need to. Okay, so now let's read the choices carefully. Remember, you have very limited time during the exam. So we have A, B, C, D, and what do you think? Some of these answers might seem like good options, but remember, you have to choose the best option for the case. Okay, are you ready? So the correct answer is D. Now let's go through each option. So A, while antibiotics might provide relief by addressing the secondary infection, they won't target the underlying cause of the lesion, which could be more serious. In the case of B, this might help for general dental care, but when there is a significant lesion like this, dietary changes alone would help. C, palliative care might be an option later, but at this point, there's still an opportunity for diagnosis. So remember, we don't know what the lesion is yet. And D, well, a dental clinic helps us to determine the extent of the lesion, and is also going to help us to take a biopsy to know if it's malignant. This step is very important in cases like this. And based on the appearance and location, we highly suspect squamous cell carcinoma, which is one of the most common oral cancers in cats. And this was actually a case I had, and that's what we did. It ended up being the squamous cell. So there are some key points to remember about squamous cell carcinoma. It's the most common tumor of the oral cavity in cats. It typically affects middle-aged to geriatric cats. It often appears in white or depigmented areas on the skin when it's like the skin form. A biopsy is necessary for diagnosis, and unfortunately, the oral form has a poor prognosis. Okay, so I hope this video was useful for you. Good luck in your exam preparation, and I'll see you next time.